Thank you, thank you. Hi everyone, my name's Jackson. I will be here talking about RoundTrip and how we're driving better health through medical transportation. So every year, actually 3.5 million people miss their medical appointments because of a transportation barrier. When you factor in the subset of people who also delay care because of a transportation barrier, you have 1 in 5 people missing or delaying their care. And that no-show rate of 20% is terrible and has a lot of cascading effects. So the first is that the hospital is losing out on revenue. They're not getting the money from those patients coming to those appointments. The second is that social workers, case managers, nurses, they're spending hours and hours of their time calling taxi companies, on hold with Medicaid brokers, trying to do anything they can to get the patients into the room. And then the third crucial effect of not showing up is that the patient's healthcare condition worsens and becomes more chronic, which then makes their overall healthcare costs more expensive, and especially if they're uninsured, that can affect the hospital too. So RoundTrip is a software subscription solution to allow patients to get to the doctors by allowing hospitals and health plans to order them rides. We've reduced our no-show rate down to 2.7%, which is 6.5 times better than the industry average, and triple what any of our competitors are able to manage. So we're really thought leaders in this space. And the simple booking workflow is a 3-step process. So you have a trip requester. This can be a case manager, a social worker, or the patient themselves. They log in, they order a ride, and we then receive that ride in our hub and make it available to a marketplace full of transportation providers to bid on. And then the ride happens, and we record valuable data. I'm sure some of you are thinking, how is this different from rideshare? And Lyft and Uber are very innovative companies, and it's for that reason that we're actually proud to be partners with Lyft. It's through Lyft that we're able to reduce ambulatory transportation costs by 40%. But it's not the full picture, especially in a medical context. If you think about patients who need more than just that curb-to-curb service, they need something door-to-door or a medically trained driver or wheelchair van or an ambulance, we have that full comprehensive suite of options available in our platform. And there's also patients who might not be able to afford lifts, which is why we can have rides paid for by Medicaid, Medicare, and other brokers. We'll also get that prior authorization on behalf of the hospital to save you that valuable time. The third sort of thing we do to stand out is that marketplace element. So for those non-Lyft rides, we'll actually connect the healthcare providers with the transportation companies. And in doing that, we really think that it's a privilege for the transportation companies to be able to do rides for the healthcare providers. And so if they want to continue to have that privilege, they have to behave well. This means that they have to arrive on time and that they have to offer us competitive rates. We know to do this because our senior leadership team has years and years of experience as paramedics on ambulance, working on the corporate side of large ambulance companies, and they've informed all of the other competitive advantages that I've talked about here today. And it's because of those competitive advantages that we actually closed our Series A about 2 months ago while we were a part of the TMC Accelerator program, which is really exciting, and this is the fun part, right? This is where we get to grow and scale solutions that have worked in places like Hopkins and bring it to the rest of the country. And so we're in Texas because we are looking for those innovative healthcare partners who recognize that access to care fits squarely in that broader social determinants of health conversation. So if any of you are innovative healthcare execs and you want to chat, just look for my hair, and I'm happy to chat with you about that and how we could drive better health outcomes. Thank you. Any questions? Sure. Yeah, great question. So you can actually call us. We work with cell phones, but also with people who have landlines, and we have a 24/7 navigation center to answer those calls. Yep. Yep, great question. So Circulation is a great company, and we've worked closely with them in the past. I think that the thing that really helps us stand out is how we've been able to do ambulance rides, and the fact that we also lead the industry in no-shows, in reducing no-shows. So our engagement's really good, and then the fact that we're able to do to actually do the CCT and SCT ambulance rides, riding helicopters in 2020. Those are a few of the things that help us stand out. Sure. So I think that's a great question. First of all, our relationship with Lyft is pretty phenomenal. They look to us for advice, for consultation on this space because we've been driving that thought leadership. If they were, for whatever reason, to pull out, we'd be fine because more than half of our rides are from our wider community. We do all the higher levels of transportation, and that ETA bidding feature that I mentioned is really just something that no one else has. And then also just to the circulation question, the prior authorizations, the fact that we'll get rides authorized by Medicaid and we'll do that on your behalf is another sort of differentiator.
To the right. One last quick question.
Go for it. Mm-hmm. So for Medicaid patients in markets where we're in, we'll enter a market alongside a flagship provider. We will get a team that will actively call Medicaid or otherwise use their software platforms to authorize each of those rides individually. And so they are pre-authorized before the trip actually happens.
Thank you.
Thank you all.